Hi everyone, it's Alice. We're very happy to have Joe today to talk about the difference and the similarity of athletic training and physical therapy. So, do you want to talk about more about yourself?
Thanks for having me.
Yeah.
So I'm a second year physical therapy student in the DPT program at Pitt. I'm also a certified athletic trainer. I went through Pitt's undergraduate program for that. I had experience working with some Division I athletics as well as high school athletics here in Pennsylvania.
Mm-hmm. We're both second year DPT students, and I remember the first time I talked to you. So we don't really talk at the beginning of the program because we're belong to different groups in the class. But I remember the first time he talked to me about how athletic trainers are capable of managing the emergent conditions on the field. For example, they can stabilize a cervical thoracic fractures with their hands, just cutting off all the braces and just stick their hands underneath the braces and kind of stabilize the players while we're moving the players off the field. So that really amazed me with how athletic trainers are capable of doing. So the purpose of this video is to talk about what is different and what is the same between two professions. So we prepared a couple different questions. So we'll start with the professional degrees. How would you describe athletic training as a profession, and what educational degrees do most of the athletic trainers possess?
So athletic training as a profession is a pretty broad and encompassing question. But most of the typical setting for an athletic trainer would be in an athletic training room with a sports team or sometimes multiple teams. The overall goals of our athletic training are injury and illness prevention, as well as wellness promotion, clinical exam, assessment and diagnosis, immediate and emergency care, therapeutic intervention, and then just healthcare administration and professional responsibility. And so you can see, just as I list those off, there are a lot of similarities there between physical therapy and athletic training. And then as for educational degrees, like I said, right now, many athletic trainers possess a bachelor's degree. Many that are at the higher level of athletics, like collegiate athletes, professional athletes, I would say most of them have a master's, and it's progressing here in the US to where everyone will have to have a master's degree.
So in order to compare two different professions, I prepared the definition of physical therapists from the APT website. So physical therapists are healthcare professionals who diagnose and treat individuals of all ages, from newborns to very oldest, who have medical problems or other health-related conditions that limit their abilities to move and perform functional activities in their daily lives. And they also talk about we can work in different settings, like school systems, inpatient, outpatient areas.
Diversity of the patient population is larger in physical therapy, where you'll treat everyone from neonates to a geriatric population. Whereas athletic training is mainly focused on an athletic population, or at least a very highly active population. There is a somewhat growing portion of athletic training where you can go into industrial work, similar to what we would have with Concentra here. I know they provide some athletic training services as well.
The next question, we're going to talk about the certificate. So do athletic trainer need to pass the board exams to become an ATC?
That's right, yeah. You have to pass the board exam and graduate from an accredited program.
As a PT, we do have to pass the national exams, and we normally take the exam during our last year of program or after we graduate from the DPT program. Third question is the similarity between athletic trainer and physical therapy. What classes have you taken in athletic training program that is similar or that actually overlaps the physical therapy program, the classes that we have right now?
So there is quite a bit of overlap. The curriculum in athletic training by accreditation standards has to include evidence-based practice courses. It has to include prevention and health promotion, again, that clinical exam and diagnosis, as well as the treatment, acute care of injury and illness, emergency response, as well as healthcare administration, strategies for psychosocial intervention, especially just knowing when to refer people out, and again, just professional development and responsibility. So similar to what we have here in physical therapy school, I will say in the DPT program, we've gone much more in depth into a lot of those issues.
How about hands-on, like techniques like manipulations and other stuff?
So it's very hands-on.
Yeah.
And at least in Pennsylvania, athletic trainers are able to do joint mobilizations up until a grade 4 mobilization, so no manipulations. All athletic trainers have to actually work, they're required to work under a physician.
Okay.
So depending on what your written orders are from that physician, it may limit what you can and cannot do.
It's kind of hard for me to imagine how you carry out an evaluation without having those physical therapy like backgrounds or knowledge.
So we learn most of the special tests, the clinical tests that we've learned. You learn goniometry. So when it comes down to it, you're still identifying impairments you're still identifying activity limitations and participation restrictions.
This is just me asking you questions. So if you figure that the patient has maybe like a ACL, not complete tear, but partial tear, because you can feel it's like a little bit looser than the opposite side, like would you just refer the patient out, or would you like do?
Typically they would go through the route of the team physician at that point.
The thing is, if as a physical therapist, we might not refer the patient out because we're able to like do some strengthening or other stuff to kind of, or see if they're like copers or not copers, to see if they need like further treatment from the physician.
Athletic trainers will also work with general rehabs, for example, an ankle sprain.
Okay.
Things like that. It's a great example where it's a relatively common injury, pretty straightforward in terms of the management protocols on that. So most injuries like that are kind of just everyday aches and pains in an athletic population can typically be managed mostly by the athletic trainer.
The next question will be focusing on the difference between athletic training. I think we kind of talked about it, but it's fine. Okay. So as we mentioned, we all help our patients or clients with exercises. So what do you think is the biggest difference between PT and AT?
We touched on a lot of the differences already, but I think there are far more similarities between professions than differences. So the biggest thing I would say is, again, back to the physical therapist kind of intervening in a variety of settings, all the way from neonates to geriatric patients. I think that scope is so broad in terms of who physical therapists will treat typically as compared to who an athletic trainer will typically treat, which is usually the athlete from high school to the collegiate and professional level. Okay. One of the big parts of athletic training is preventing injury and trying to be prophylactic about that. Yeah. But I could also argue that that's what we do as a DPT as well. We try to, as we're rehabbing our patients, especially our athletes, giving them strategies to manage on their own and strengthen in advance, for a season. So again, there are very similar goals there, and it's hard to say sometimes. So we're gonna talk about the career right now. What job positions do athletic trainer or athletic training graduates normally do? Again, it depends on your location and setting, but many go into that high school setting and work with high school athletes, collegiate athletes, or some continue to work and progress to the professional level. And it's very competitive to work at the professional level. You need the additional certifications, you need a higher level of education, you need to pursue as many opportunities as you can, really, to internships, things like that, to really set yourself up for success to get to that professional level. And even then it's still very difficult to attain that here in the US. Just think of it as a tool in your toolbox. It's a method of thinking and engaging with your patients, but it's also, you can take that into other fields then. So some people even go more into the business route of things if they want to. So for physical therapists in the United States, I would say, because I know in Taiwan and even other Asian countries, we normally divided or categorized physical therapists into 4 different professionals. But I feel like over here, we're more dividing physical therapists based on their settings. Like, even we're in outpatient ortho, we might still have patients that's like post-stroke for a couple of years and they have like other musculoskeletal issues. The next question is very sensitive about salary. So what do a athletic trainer normally make? So as an athletic trainer, the average salary currently nationwide is $45,000. So it's, you know, it's
Yes.
with the hours that are being put in
Yeah.
to the job and you know the time spent with your athletes and with your team and providing that coverage that they need. It's not a lot in terms of compensation,
Yeah.
you can see. And that's one of the challenges that the profession really faces is trying to balance that work and life balance. Because you know, for example, during football camp, you may be working 80 to 90 hours a week with a team for 20, 25 days straight, sometimes without a day off. Most of the year, that's the schedule. You know, they're long hours, and that's one of the difficult things about the profession, and that's why it is so unfortunate that the salary is the way that it is.
Yeah. Okay. So for PT, I actually did some research on salary.com as of January 31st, 2019. The mean salary for a physical therapist is $85K per year. So it's like almost like double.
It's considerably higher.
Yeah.
Like, is it worthwhile? Will it give them a better chance of working with the team? Basically,
Yes.
like,
Yes.
will it increase their livelihood? So that's a complicated question to answer because it comes down to finding a program that really suits each individual best based on where they're at in their training. So if they are trained as a physical therapist already, and they're able to find a 1 or 2 year master's program that will allow them to sit for the boards and become an athletic trainer, then I do think it's worth it in the long run if they really want to specialize and work with athletes in the U.S. I think that's a great way to go about it. But if they're only able to find more of those entry level master's programs where it is a longer process, then that may not be the best route to go. They may be better off trying something like the SCS or an OCS program to gain experience with that population but not have to undergo a more prolonged education for it.
So it's just my opinions, but I feel like if you're a PT, like if you're a foreign trained physical therapist and your end goal is to work with professional athletes or just athletic populations, it might be easier for you or like more practical for you to come here and then pass the national exams of physical therapy and then go ahead and pursue the sports like certified specialist certificate. That might be like a more, I don't know, like a better route for physical therapists. Thank you very much for sharing all the
thank you for having me.
Yeah.
One last thing. If you do want to learn more about athletic training, you probably get even better answers than what I gave today by going to the NATA.org website. So that's the National Athletic Trainers Association here in the U.S. That's a great resource to answer any other additional questions you have.
Sounds good. Okay. See you guys next time. Bye.
Thanks.